My presentation is on TNF inhibitors and psoriasis. The question I'm answering is, how do TNF inhibitors treat psoriasis and psoriatic arthritis on a molecular level? In order to understand how TNF inhibitors work, we have to know what psoriasis and psoriatic arthritis is. Psoriasis is an autoimmune disease of the skin where the body develops thick plaques and scales as a result of events of mechanical nature. People with psoriasis will develop damaged differentiation of keratinocytes within the epidermis. It approximately affects 2 to 4% of the population and can happen at any age. It can be genetic, so meaning if your parents have it, you're at higher risk, or it can just be bad luck, and you can get it for no reason. Psoriatic arthritis is a secondary effect of psoriasis. Usually, typically in people that are older, if they have psoriasis, they will develop psoriatic arthritis. How does it work on a cellular level? Well, it happens in 3 phases. The first is the sensitization phase, the second is the resting phase, and the third is the active phase. This is pulled directly from another website, it is quoted. At the onset, the immature dendritic cells commonly found in tissues will recognize and ingest the exogenous antigens and migrate to the secondary lymphoid organs in order to treat and present the antigen to T cells. Following that antigen uptake, dendritic cells undergo a maturation process to cope with the inflammatory conditions, largely due to cytokines such as tumor necrosis factor alpha and interleukin 1b, 1 beta, or to deal with microbial products that excite microbial cells through specific receptors. The first 2 stages are the sensitization phase and the resting phase. The last is the active phase. During this phase, when psoriatic plaques are formed, the first visible effects are surface vascular infiltration of lymphocytes and monocytes and the distension of blood vessels in the dermal papilla. The passage of the immune cells through the endothelial wall of the vessels is called dialysis, which we've all heard before, and is probably performed through pores formed between endothelial cells. This process seems to be dependent on the integrins. Immune cells can be activated after they migrate to the skin in dermis and epidermis. Various groups of antigen-presenting cells can stimulate T cells, and vice versa. T cells that have migrated to the epidermis may additionally be activated by keratinocytes or also proliferate as a consequence of activation on the skin. What is a TNF? TNF stands for tumor necrosis factor. In patients with psoriatic arthritis or psoriasis, it has been found that the patients have high levels of tumor necrosis factor, which is how they ended up developing the TNF inhibitors. Tumor necrosis factor is a multifunctional cytokine that plays a role in cell survival, proliferation, differentiation, and death. So when you think about it, with psoriasis, the skin cells turn over twice as fast, which is why the new tumor necrosis factor is so high in those patients. With increased levels in psoriasis, this could be the cause for the skin cells overturning and regenerating as fast as normal skin. How do TNF inhibitors work? Humira, which is one of the most common, you've probably seen commercials for it. It is a fully human monoclonal antibody that binds to the TNF alpha, which interrupts the TNF cells, neutralizing their activity and slowing down the immune response, and therefore slowing down the turnover rate and the rapid reproduction in skin cells. These medications that treat psoriasis are called biologics, biology meaning life, because they are all live injections.